Feel the energy? Great day and a half. My future and purpose in life started 2 generations ago in Amritsar, India, with this man, Dr. Mehra, my grandfather. He was not only a medical doctor, but a father, a community activist, a politician, and much, much more. He was a man of passion, a true visionary, and a Renaissance man of his time who imagined a healthier and a happier world, and more importantly, was willing to take the necessary action to see his vision through. During the partition riots between Pakistan and India in the mid to late 1940s, he established a free homeopathic medical hospital for the refugees. And in this hospital, he envisioned a system with the people and the patients at its core. A system without borders, without judgment, without politics, a system that worked for everyone, not just the privileged few. And in building this hospital and this system, he engaged the entire community to participate because everybody had a role in the healing process. He had a profound influence on everyone that he met, especially my father, who became very close to him and eventually married his daughter, now my mother. My parents came to this country over 4 decades ago on a honeymoon whim and a dream, carrying nothing but the values passed on by their parents. They came here to live a fulfilling life and provide even greater opportunity for their kids. Things worked out really well. My father became a successful physician, my mother a microbiologist. And in fact, my father continued the legacy of my grandfather in opening up a free medical clinic as an outpost in the hospital in which he worked. He too dedicated his life to serving those in greatest need. Growing up, I was given every opportunity you can imagine. They encouraged us to think freely, to experiment with new things, embrace every opportunity in front of us. And so I did, and I had an obsessive passion for learning and an odd sense of curiosity, which ultimately took me down the path to pursue a career in medicine as well. I recall vividly the first few days of medical school where we take the Hippocratic Oath, always putting the patient first, doing no harm, dedicating our lives to prevent sickness and illness. And I'm reminded of a patient of mine when I was a medical intern. Her name was Mary. She was a frail, elderly woman in her mid-70s, and she had diabetes. She had congestive heart failure. She had arthritis, among several other ailments. And this was the 3rd time that she had actually been admitted into the emergency room within the span of 1 month. And as good clinicians, we examined her, we treated her symptoms and her condition appropriately, and then sent her back to the nursing home where her care was administered. Now, what troubled me was why was she continuing to be readmitted into the hospital and coming to the emergency room? And when I dug deeper, what I found astonished me. It was everything but her medical condition that brought her back into the hospital. It was the lack of follow-up, the poor communication between providers, the mismanagement of medications, the lack of involvement of the family, the fragmentation of our chart keeping. And what I quickly realized was that our intense focus on the patient was making us blind to the larger healthcare system. We did not treat our healthcare system with the same level of respect and the same standards of care as we did our patients. The evidence is all around us. We see reports come out from the Institute of Medicine and the CDC every year telling us that our very own medical system accounts for the majority of the morbidity or mortality in this country, consistently ranking amongst the top 3 causes in this country, up there with heart disease and cancer. The very oath upon which we created our standards and our principles had itself turned into a disease, causing us to inflict harm on our own health system. Now, while this may not be a revelation to many people out in the audience, it troubled me greatly because knowing this, we were doing very little about it. And so, how did we get this way? We're taught that when industries become problematic or stale, that the markets will tend to correct themselves. This certainly was the case, or is the case, happening in education, in the publishing industry, in the music industry. But why was this not the case in healthcare? What was holding us back? Why are we always last in the race to innovation? And so I spent the next several years trying to find answers to this and unravel this mystery and uncover patterns and create and find those signals from the noise. And it took me to interesting places and having interesting conversations. And what I discovered was that finding good ideas was not our problem. In fact, we have more ideas today than ever before in the history of healthcare. We have more startups just in the past year alone, more investments being thrown into healthcare technologies and research. Advancing our science is not the problem. We have cures and treatments for almost every recognizable condition out there today. Just in the past several decades alone, we've practically doubled our life expectancy. So why is this important? It's important because I think the real issues run deeper than this. We're not going to solve our problem with innovation by throwing more ideas at the problem, by upping the volume and the noise. We need to change the conventional models of thinking and the fundamental principles in how we innovate in healthcare. Darwin was very correct when he said it's not the strongest of the species that survives, nor the most intelligent, but that who is most adaptive. Healthcare historically has been a culture that resists change. It's an industry that prides itself on the sanctities of rituals, rites of passage, ceremonies. I went through it myself. Change does not give us confidence. It doesn't give us that measure of proof or that measure of evidence that we seek. In fact, we spend every ounce of our energy trying to create order out of chaos, and change disrupts that very order that we work so hard to preserve. Over the years, I learned that what people say they want and what they actually do are oftentimes two very different things. I call this the want-not syndrome. We want reform, but not if it impacts me. We want to reduce costs, but not at my expense. We want to get healthier, but we don't want to work for it. And when we do end up finding solutions to these problems, we're creating solutions that are solving yesterday's problems, not into the future. And we're layering on these complexities in our healthcare system that's creating this wall that's impossible to penetrate. And the institutions who benefit most from these complexities are the ones trying to preserve that wall. So, having great ideas and great science is great, but we're never going to get anywhere or move healthcare forward if we don't learn to flex and adapt. We're left with two choices. Either one, we can hoard old ideas and thinking, or two, we can construct new models of healthcare that celebrate and reward change and different thinking. So who's going to lead this charge? I want to make the case that we need to invest in and cultivate a new form of health leadership, change agents that I call health artists. Now, I'm not talking about this kind of art, which I think is beautiful and great, but rather this kind of art, people who see the world with a different lens, a perspective with health and wellness as their lens. Healthcare is creatively challenged. The principles of creativity, of experimentation, diversity, collaboration, and openness are counter to the values in healthcare of autonomy, privacy, conformity, evidence. In fact, our medical education system squeezes every ounce of creativity out of us. In the past few decades alone, we've created more specialists than ever. And as a result, we're limiting our ability to see perspective and our willingness to experiment. Renowned investor and entrepreneur Vinod Khosla, just a few weeks ago, made a provocative statement suggesting that 80% of what healthcare professionals do today can and will be replaced by machinery and technology. Now, I'm not here to argue one way or the other, but rather my focus was on what about the other 20%? What are we to make of those individuals? And is that the other 20% the role of the new healthcare professional? And if so, are they creatively equipped? Now, I'm not trying to say that science is not important. I'm just trying to say that we need to rebalance the equation between the art and science of medicine. Ken Robinson, in a former TED Talk, said that if you're not prepared to be wrong, you will never come up with anything original. I could not agree more. We need to create safe havens that allow for non-judgmental experimentation and cross-industry collaboration to cultivate this new breed of health leaders. And I'm pleased to see a couple of these prop up, including the EPIC Challengers Institute in campus in Rhode Island, which I'm a part of. So who can become a health artist? I believe everyone can and should become a health artist. Health will impact and affect every single one of us at some point in our life. Like the climate, like our environment, we need to treat it with the same level of respect. I think our challenge is how do we get people to care? What's happening in healthcare resembles a social psychological phenomenon called the Genovese Effect, also called the bystander effect. And this effect the phenomenon states that the probability of help is inversely correlated to the number of bystanders. In other words, the more people that we have to help, the greater the likelihood we think it's somebody else's responsibility to step in and intervene. That's what's happening in healthcare. We all assume and think that it's somebody else's responsibility, when in fact, I believe it's everybody's responsibility to participate. The good news is, we can. Innovation is no longer limited to the select few at the margins who have access to the expertise and the capital. Cost of technologies have come down significantly, and access to ideas is around us everywhere, so everybody has the opportunity to participate. 15, 20 years ago, if I told you that I was going to turn your home green, you would probably all look at me with blank stares. Today, it's part of our daily lexicon. It's how we live our lives, at least for the most of us. Similarly, we need to reset the social norms in healthcare. It's not just about treating disease, it's caring for people. It's constructing new surroundings and rethinking our daily experiences to be more health and wellness oriented. Our retail centers, our shopping centers, our homes, our workplaces, our parks. We've democratized our ability to save the planet, and now we need to do the same for our own well-being. Now, I don't know what the future of healthcare will look like when my kids grow old. 2 weeks ago, I became the proud father of my second child, and upon hearing the news, my cousin in India sent me a beautiful message saying, there are two great moments in life. The first being the day you were born. The second, the day you discover why. Now, I can't guarantee that we'll find a cure for this disease that has inflicted our health system. But I can promise you that as a health artist, I will do everything in my power to make a difference so that the next generation can live the life and the legacy that was passed down from my parents and my grandparents. And I hope you'll join me in this quest. Thank you.